50 years after the last American troops left Vietnam, the war's toxic legacy still haunts millions of veterans. Agent Orange, over 11 million gallons, was sprayed to strip away jungle cover, but it poisoned the very soldiers it was meant to protect. The chemical's deadly contaminant, dioxin, seeped into the land, water, and bodies of our troops, remaining for decades as a hidden threat. Veterans returned home only to face aggressive cancers, birth defects in their children, and a government slow to acknowledge the cause. Many felt abandoned, forced to fight a new battle for recognition and care. Today, the consequences are everywhere. Aging veterans in VA hospitals, families grappling with generational illness, and a public health crisis that refuses to fade. The war in Vietnam is not just history, it's a daily struggle for countless American families. The story of Agent Orange is a stark reminder of the hidden costs of conflict. For many, the battle continues in doctors' offices and bureaucratic halls, not on distant battlefields. The poison lingers, a silent enemy that never left. The fight for justice and care is ongoing. The war's legacy is written in the bodies and lives of those who served and their children. Agent Orange is not just a footnote, it's a present-day emergency. The cost of war is measured not just in lives lost, but in lives forever changed. For these families, the Vietnam War never truly ended. The battle for health and recognition rages on. Agent Orange was a powerful herbicide used by the U.S. military to strip away jungle cover in Vietnam. Its name came from the orange stripe on the storage drums. From 1962 to 1971, Operation Ranch Hand sprayed millions of gallons across South Vietnam, destroying forests and crops. The real danger wasn't just the herbicide, it was dioxin, a toxic contaminant that settled on land, water, and people. American troops lived, ate, and drank in contaminated areas, unaware of the long-term risks. The chemical's persistence means it remains in the environment and human bodies for years. Exposure was unavoidable. Soldiers drank from tainted streams, ate local food, and breathed in the toxic mist. They were told it was safe, a tragic mistake. The spray missions covered an area the size of Massachusetts, fundamentally altering Vietnam's ecosystem. But the most lasting impact was on human health. Dioxin doesn't break down easily, turning a military tactic into a lifelong health sentence. Veterans were left with chronic illnesses, and their families with generational consequences. The lack of information and protection turned a tool of war into a source of suffering. Agent Orange's legacy is measured in lives, not acres. The seeds of disease were sown alongside the seeds of war. For those exposed, the effects have lasted a lifetime. Nearly 3 million Americans served in Vietnam. Up to 2.6 million may have been exposed to Agent Orange. Exposure wasn't limited to combat troops. Pilots, mechanics, and even Navy personnel on inland waterways were at risk. The poison was everywhere, an invisible threat that spared no one. For years, the government denied the problem, leaving veterans isolated and betrayed. Their illnesses were dismissed, fueling a grassroots fight for recognition. Veterans organized, lobbied, and funded their own research to prove the connection. The battle for acknowledgement was long and grueling. These veterans, already weakened by disease, had to fight another war at home. Their persistence finally forced the government to confront the truth. The struggle for justice became their new mission. Agent Orange's dioxin contaminant is a potent carcinogen and disrupts the body's systems. Veterans exposed to it face cancers, diabetes, heart disease, Parkinson's, and more. The VA now recognizes a growing list of presumptive conditions linked to Agent Orange. These illnesses are chronic, progressive, and often require lifelong care. Veterans endure endless doctor visits, medications, and a steady decline in health. The war's unseen wounds have stolen their golden years. Independence, work, and quality of life are lost to a poison they never saw coming. The promise of a normal life after service was broken. For many, the war followed them home, in the very cells of their bodies. Agent Orange's impact extends beyond veterans. It haunts their families. Children of exposed veterans face higher risks of birth defects like spina bifida. Many report increased rates of cancer, autoimmune disorders, and developmental issues in their descendants. Families live with a toxic inheritance, fighting for the health of future generations. The emotional and financial toll is immense. Spouses become caregivers, careers are sacrificed, and medical bills pile up. When a child is born with a severe defect, the challenges multiply. The stress strains relationships and leaves deep emotional scars. The family, meant to be a source of strength, becomes another casualty of war. Agent Orange seeped into the fabric of American families, tearing them apart from within. The legacy of exposure is a multi-generational battle. The struggle for benefits is a harsh reality for thousands of veterans. Art Gentry, a 77-year-old veteran, suffers from Agent Orange-linked cancers, but was denied VA benefits because he served at Subic Bay, not in Vietnam. The VA's strict list of presumptive locations leaves many veterans in limbo, forced to prove exposure decades later. Art's story is not unique. Countless veterans face the same bureaucratic maze. Even legal precedents haven't expanded the list, leaving veterans trapped by lost records and shifting requirements. Despite setbacks, Art and others continue to fight, seeking not just compensation, but dignity and acknowledgement. Their battles have lasted decades, a testament to their resilience. The system's injustice is clear. Where you served can matter more than what happened to you. Veterans like Art are forced to fight for recognition when they should be enjoying retirement. Their struggle is a powerful symbol of the ongoing quest for justice. The fight for acknowledgement is far from over. For years, the government denied any link between Agent Orange and veterans' illnesses. The Agent Orange Act of 1991 changed everything, establishing presumptive service connection for certain diseases. Veterans no longer had to prove direct causation, just service in Vietnam and a qualifying diagnosis. This opened the door to care and compensation for thousands. The law required ongoing scientific review, allowing new conditions to be added as evidence grew. It wasn't perfect, but it was a crucial first step toward justice. The act set a precedent. When the military exposes troops to toxins, the government must care for them. This principle shapes future legislation for veterans exposed to other hazards. The PACT Act of 2022 marked a major expansion of benefits for veterans exposed to toxins. It added new presumptive conditions for Agent Orange, including hypertension, a game changer for many Vietnam veterans. For decades, claims for high blood pressure were denied. Now, thousands are finally eligible for care. Yet, the fight isn't over. Veterans exposed outside Vietnam in places like Thailand and the Philippines still face uphill battles for recognition. Over half of Subic Bay veterans' claims are denied, creating an unjust system based on location, not illness. Advocacy groups are pushing to expand the list of presumptive locations. The burden should not be on veterans to prove exposure when the government knows where toxins were used. The next frontier is justice for all veterans harmed by Agent Orange, no matter where they served. The struggle continues, but progress is being made. The fight for fairness is far from finished. Despite progress, many Americans remain unaware of the ongoing Agent Orange crisis. Hundreds of thousands of veterans and their families still live with its consequences. Advocacy groups work tirelessly to raise awareness, share stories, and push for justice. Agent Orange Awareness Month is a chance to educate and honor victims. The story of Agent Orange is a lesson in the hidden costs of war and the need for accountability. Our responsibility to veterans extends far beyond the battlefield. Learn their stories, support advocacy, and demand action from lawmakers. The fight for justice is not over. These heroes need our support. Their battle is our battle. It's time to stand with those who served and ensure they are never forgotten.